Hello, I'm Dr. Paul Lorenc, and today I'd like to demonstrate injection of the platysma and the lower muscles of the face using a neuromodulator. In this case, we're going to be using Xeomin. The dilution that I use is 50 units. It's diluted in 1.25 cc's of normal saline for dilution, especially in the lower face. I like the lower dilution to have the specificity, especially when we're injecting the platysma, the DAO. I don't like the diffusion at a higher dilution. I like to demonstrate not only the injection of the medial platysma, the lateral platysmal band, but also the DAO, and also injection at the angle of the mandible, what some physicians are referring to as the Nefertiti lift. What it does, it really lessens the pull of the lower muscles of the face, and specifically the platysma, and allows the upper musculature of the face to exert its forces and really define the angle of the jaw. Also, as you know, platysma, and if I can just demonstrate. Platysma is a very broad muscle. It originates from the first and second rib over the pectoralis and the deltoid, and then it inserts all the way onto the mandible in 75% of the patients on the other side of the other platysma, and also into the risorius. So what we're doing today is we're going to be injecting the medial border of the platysma, lateral border of the platysma, the insertion of onto the mandible, and in conjunction of that, because a large portion of the downward force is through the DAO, we'll be injecting 2 units on each side. What I have done is, if you can animate, Barbara, please just really say E, really hard. You can see the tremendous pull of the platysma, especially on the right side, the lateral band and the medial band, less so on the left. And what I have done is marked 2 different colors. The colors in red will represent 4-unit injections, and the colors in blue, as you can see, it's 2-unit injection of Xeomin per point. Relax, please. So we'll start with, and you can start either way. I will start with the face has been prepped before. I like to start with the DAO, and again, in this particular dilution, 0.1 cc is a 4-unit injection, and 0.05 injection is a 2-unit injection. We'll start with the DAO. And we'll do the end. Just turn your head a little bit that way. Perfect. And again, just to lessen the activity of the platysma, I think you have to incorporate the insertion onto the mandible. These are very simple injections. What I do as far as the injection, I pick up the edge of the muscle, and the reason why I do that is, you know, that the muscles that are associated with swallowing are very closely associated. Just a little bit towards me, please. So you do have to pick up the platysma muscle. Now this is a 4-unit injection, so it's a 0.1 cc injection at this dilution. Again, another 4-unit injection, which is 0.1 cc injection, spaced with a 2-unit, which is 0.05. And again, 2-unit. May I have the next one? And obviously, as you can see, I have preferentially injected much more on the right side, because the right medial platysmal band is much stronger in Barbara's case, so the dosage is much higher on the right side versus the left. Again, 2 points into 2 units into the DAO. A little bit about DAO injection. I like to inject it a little bit about midway between the commissure and the angle of the jaw. Standard injection is closer to the angle of the jaw. I prefer the injection to be higher because the DAO being a pyramidal muscle, if you inject it higher, it's more concentrated muscle fiber, or there's less muscle mass superiorly, therefore the effect of the neurotoxin is more concentrated. Just turn your head a little bit to the right. Again, insertion onto the mandible, 2 unit injections in each point. Again, picking up the platysmal muscle and keeping it away from the underlying musculature. Just straighten it out. The total dose was 48 units. That's my standard dose, whether I'm using Botox or Xeomin. I have the patients resume full activity the next day, and typically I will see the patient at 1 week in follow-up, and we take typically post-injection photographs with full animation. Thank you.